Hello and welcome back to the final webinar. The Basic Forms training is presented in a series of webinars available to you on demand, 24 hours a day, 7 days a week, and this is webinar 3 of 3. Please make sure you let your supervisor know when you complete each webinar so that they can update the MIS. You met us in webinar 1 and 2. We are now going to present the material for webinar 3. Again, I'm Corinne Noble.
And I'm John Heck.
As I've said before, the MIS has been built with feedback from people like you. We hope that you're feeling more confident now on the use of it and that soon you will become an expert in entering the data and that you let us know how we can make it even better. Everything we mentioned today will make more sense once you have entered data several times. It will get easier with time, so please have patience. We hope you had a chance of shadowing a more experienced worker at your site. If you still haven't, make sure you watch this webinar after you have. By the end of this webinar, we're also hoping you will have a clear picture of the data collection system and its hierarchy. In webinars 1 and 2, we discussed the pre-enrollment and after-enrollment forms, talked about how entering certain forms enable others to become available for data entry. In this third webinar, we will discuss the post-target child ID forms, the forms that are enabled once the target child is born and his or her information is entered into MIS. It is our hope that by the end of the series of webinars, you will understand the importance of collecting and entering the information and the key role you have in this process. The data you enter to the MIS is used to measure program outcomes and fidelity to the model. We know the HFA model works in preventing child abuse and neglect and promoting parent-child interaction to create a healthy and safe environment for children. The information you enter tells us how you're doing as a program in regards to the best practice standards, if targets are met, or if there are things that need to be improved or changed. The information you enter tells us a story. It reflects the reality of the families you serve. If data is missing, we don't get the full story.
We have support for you in case you have questions or a concern or problem about your software. You can either call us at the number on the screen or the email. We prefer that you use the portal on the home page for communicating with us. Here are the folks that might answer the phone, and both Corinne and I also answer the phone on occasion. So, where did we leave off? As you remember from webinar 2, once the target child is born and you enter the target child information and birth outcomes form, the post-target child ID forms in the third column are enabled. These forms capture demographics, activities, actions that take place after enrollment and after the target child and birth outcomes form has been entered. As you can see, we have the target child medical form, the parenting stress index, the ASQ, ASQ SE or social emotional, and the follow-up form. Oops, too many. And again, here are the forms that I just mentioned from the previous page.
The target child medical form, which is the first one on that list, documents preventative medical services and other medical community visits provided to the target child. This is completed every time the target child receives an immunization, for example, goes to the doctor, or has a lead screening or other visits. Complete this form only for the target child and not for the other children in the household. In the case of multiple births, complete one form for each of the target children. When adding an urgent care visit, target child non-well baby visit, or an ER visit, at least one medical reason is required, but the field allows you up to 3 reasons to be entered. This form is used for many performance targets, immunizations at 1 and 2 years, and well baby visits.
The PSI, or the Parenting Stress Index, measures the stress of the PC1 at multiple points during home visiting. This is a copyrighted form and must be requested through the MIS support line. Do not copy it. The PSI is done only when there is a target child. If prenatal, you wait until the baby is born and then have 30 days to complete the initial one. In a postnatal situation at enrollment, the first PSI is due before 30 days after enrollment. So you want to get that one done as soon as possible after enrollment. The PSI is completed by the PC1. They actually fill the form out themselves. If the PC1 has a low reading level, the home visitor can read the questions to the participants. There is a Spanish version, and you can contact the support line and get a copy of that as well. If there is a multiple birth, when the first PSI is completed, you ask the mom, the PC1, to pick one of the target children and think of that child when filling out the form. When the next PSI is due, have the PSI think of the same child and fill the form out again. This assessment asks hard questions, and it's helpful for home visitors to do the PSI herself to get a sense how it might make the participant feel when answering the questions. Be prepared for strong reactions. All items need to be answered in all 3 sections. The form is not valid if there's more than one missing item in any one section. The computer is going to assign a value to that missing item by averaging the scores in that section. You'll notice that the answers are here. SA for strongly agree, and then up here it tells you exactly what everything means. A for agree, N for not sure, D for disagree, and SD for strongly disagree. You'll notice that I have written some numbers here above the letters. This will help you do the data entry, because in the system, by typing a 1 in any answer, you'll get SA. By typing a 2, you'll get an A, etc. This is a proxy for us to measure child abuse. So the idea being that the higher the stress, the higher the potential for child abuse. The lower the stress, the lower the potential for child abuse. So our performance targets are going to look for those families where there's high stress in the beginning, and then measure it over time to see if that stress goes down, thus reducing the potential for child abuse. This is a 2-page form. It is sealed so that the PC1 does not see the second page, but when you, after it is filled out, bring it back to the office and open it up so you can see the second page. You'll notice that over here, the scores that the mom has circled will come through and you'll be able to score it. There are 3 basic sections. One PD, which is parental distress. One is PCDI, which is parent-child dysfunctional interaction. And the third is DC, or difficult child. These 3 scores make up the total stress score when you add them together. You'll notice at the top there's something called defensive responding. Defensive responding picks out these shaded items here and adds them up. If this score of those shaded items is less than 10, it's a cause to think about what that might mean. And it could mean one of 3 things. It could mean possibly that the mom is lying. She's not telling the truth. The second is that the mom is a wonderful mom and doesn't have stress. As we all know, there's a great deal of stress raising a child, so this is probably not the case. And the third is a little more concerning, and that is that the mom is kind of spaced out, and she's not paying attention and just kind of answering questions haphazardly. So talk with your supervisor if this is indeed the case and decide what that defensive responding score might mean. As I said before, this form is used to feed into 5 different performance targets. And the most important one for you to enter is the first one, because that determines the initial level of stress of this mom. And if it is high, we want to especially pay attention to these families and provide the model to them. And in most cases, just by providing the model is going to bring that stress down. And this last screen about the parenting stress index is just to show you the first 5 scores there. You'll see the 5 in front of the strongly disagree. And as you tab into that field, if you press a 5, you'll get that answer, or a 4, or a 3, or 2, or 1. You'll also notice that up above here that the scores are being tabulated for you as you enter items into this form.
The next form is the ASQ Score Sheet. The Ages and Stages questionnaire is another best practice standard and a performance target. It is a standardized child development tool. You need to be trained in the use of it prior to administering it. It is required at 4, 8, 12, 18, 24, 30, 36, and 48 months based on the age of the child and is adjusted for prematurity when needed. It is administered within a 30-day window on either side of the test interval, which provides you with some flexibility, 30 days before or 30 days after the 4-month interval, for example. The ASQ is used to measure the child's development progress. An under cutoff score in any of the 5 domains requires a referral for early intervention programs and IEP services. The MIS monitors the completion of the ASQ and helps you track any referrals made to EIP services or early intervention programs. Then we have the ASQ Social Emotional Score Sheet. And this form records the results of the ASQ Social Emotional Scale for the target child. The questionnaire is administered at intervals until discharge or graduation. The ASQ SE is used to measure the child's social and emotional developmental progress and also determine any need of referrals to services. The form has a different window from all other forms with validity. And what does validity mean here? The ASQ SE has separated questionnaires for children 6, 12, 18, 24, 30, 36, 48, and 60 months, and each one can be used within 3 months for the 6 months through the 30-month intervals, or 6 months from the 36 to the 60-month intervals of the chronological age targeted by the questionnaire. For example, the 6-month ASQ SE can be used with infants 3 months to 8 months, and so on.
And just before we move on to the next form, just remember that with the ASQ, the issue arises when the score is below cutoff. With the ASQ SE, the issue arises when the score is above cutoff.
So now we're going to go on to the final form presented in this series of webinars. Aren't you happy about that? This is the follow-up form, and the follow-up form is used to update information collected on the intake form, the TCID, and form other follow-up forms, and to update demographic and other information of the parent, the OBP or the other biological parent, and if appropriate, another caretaker like PC2 residing in the household. This form is completed when the target child is 6 months, 1 year, 18 months, 2 years, and then at yearly intervals at time of discharge or graduation from the program. When completing a follow-up form, you are to consider a time frame. For the 6-month follow-up, you record what happened between intake and when the baby is 6 months old. For the 1-year follow-up, you record information about the family from the period since the last follow-up, or what happened between when the TC was 6 months old and a year old, and so on. Many items on this form are used to measure performance targets. Education and employment on this tab, for example, is measured at the 1-year and the 2-year follow-ups for PC1, OBP, or PC2. We know that 50% of families will be enrolled in an education program, job training, or job placement program, or will obtain employment by the target child's first birthday. Another of the performance targets is that 75% will have this same education or job training placement by the target child's second year or second birthday. If PC1 is under 21 at intake and without a high school degree or GED, the performance target is that 85% of PC1s will be enrolled in a degree-bearing program or have received a high school degree or GED certificate by the time the child is 6 months old. Another of the tabs important in the follow-up form is the PC1 issues. And here is the chance to update what we learned at intake, You've been working with this family for 6 months now, for example, in the first one, and have established a relationship. The participant could feel more confident to open up to you about issues they had not shared before. So make sure that you've made the appropriate referrals you've probably been tracking any emerging issues in the home visit log, but this is the follow-up form is a very important place for you to document these emerging issues. Another tab that we have here is PC1 Services and Insurance, and encouraging parents to access a variety of community resources is an essential part of your job. Linking parents to providers for preventative health care, for example, is one of them. As you know, PC1 having a medical provider is one very important performance target. 90% of PC1s will have a medical provider, and it's also one of our best practice standards. And as I usually say, the ER is not a medical provider. Another of the tabs here is PC1 subsequent pregnancies and birth control. And this will be the very first time that you will inquire about birth control. It may be presented in a conversation about birth spacing, for example. If the PC1 became pregnant during the follow-up period and you answered yes to item 12A, the PHQ9 tab will become available. But here, as you can see, it's grayed out, or isn't. Oh, no, it is available there.
No, it's grayed out because no. We have said no here.
Yes.
If that said yes, it would enable this tab.
Yes. Okay.
Are we done with it? We're done with this one. Okay.
Yeah.
Let me take this one.
Yeah.
Okay, and then the next one is the TC tab. Now, this is where we're recording the history of the breastfeeding, and this as well is a performance target, and we're looking for the mom to be breastfeeding for at least 3 months. What else do we have here? Again, a medical provider for TC is a performance target as well as a best practice standard. So we want to work toward having a regular doctor to go to, as opposed to, as Corrine says, not going to the emergency room or some emergency situation. We're also recording the health insurance of the family and the baby. And finally, lead assessment at the bottom here is a performance target. And this is not the blood work. This is the questions about whether there's lead in the environment where the baby lives. If you look at the paper form, you will see the questions that you should ask the family in order to determine the positive or negative situation.
If we had a PC2 and it had been identified on the ID and contact, you will be asked on the follow-up forms about the person. Similarly, if you had the OBP living in the household at time of enrollment, you will be asked, about OBP. So questions about OBP, PC2, and PC1 are basically identical. So the items are the same. We talk about education and jobs.
You'll also notice that we ask whether they're living in the home. And we ask that about all 3 participants because, as we know, there are occasions when these individuals leave the home. Mm-hmm. And if you note that they are not in the home, we do not expect you to answer questions about them. Mm-hmm. On the next tab is the family tab. And this is where we're asking about the involvement of the biological parent, and this is an identical question that we asked on the intake form. This is also the only place we ask you anything about CPS or ACS. And we simply want to know whether you decided as a program whether you needed to call the hotline. This is not whether there was an indicated case or anything else. It's simply what behavior did your program do related to this family around CPS or ACS. Then we're asking, again, the very same kinds of questions that we asked on the intake form. Who lives with a PC1, average monthly income, and the value of the benefits. Again, these are hard questions to ask, and maybe by the time you're at the 6-month follow-up interval, they might be a little more willing to share. And again, the importance of finding this information out is so that you can get the full picture of the family and better be able to serve them through referrals or curriculum or whatever else would be appropriate. Finally, or not quite finally, but down below here, we're also asking you about the benefits again, specifically what they are. Do we have the TANF services on here? We don't. And then there's a question down below about TANF services, and that has to do with a different kind of funding stream for the state, and that's something you should talk more with your supervisors about how that fits into your program.
Finally, the last tab on this form is for McVie programs, and if you are a participant in McVie program, you will be required to collect information on this tab. Let's read through these questions. So then, again, we had this at intake. We're asking about homelessness or the type of living situation, the continuity of health insurance coverage, and whether the home assessment was completed in this follow-up form or not.
And the home assessment is something that was only done at 6 months, and now it's supposed to be done at every follow-up interval. You also should have been trained in this assessment prior to administering it. And just know that going forward in the future, we are going to be using the CHEERS assessment validation tool regarding the parent-child interaction. Also note that on the target child questions, these are questions that we have not asked, and this is the first time we're asking about what is the usual source of medical care, and also about the dental care.
So now we're done. You must be
almost.
Yeah, almost. We're going to check to see whether you were paying attention again. So we're going to go through these, check your knowledge. This is number 1. The 6-month follow-up is due A, when the TC is 6 months old, B, 6 months from the intake date, C, when the participant has been on level 1 for 6 months, D, any time before the TC turns 1 year old.
We'll give you the answers in a little bit. The first PSI is due 6 months from intake, within 30 days of intake, within 30 days of the birth of the TC, or none of the above. So that's number 2. Remember, you can pause this webinar at any point if you need to think about this a little bit. Or if you want, you actually can go back and look it up. But
no cheating. Congratulations. You have completed Module 3. You've been through all of these webinars once, but you may want to go over them again. I don't know about that, but it might be a good thing once you've completed a few forms, or use them to go over a particular form if you want to refresh your understanding on them. Remember that you can always call us and ask questions. We're always there to support you. So now you can go ahead and check your answers, and thank you so much for your participation and attention.